Have you been bothered that your new one will soon arrive and you don't know much about him, what to expect? Well, never mind. You're in the right place. We're going to be talking about all that today. Hello, my name is Dr. Stella. You're welcome to Little Angels Corner, your favorite channel on parenting tips for your little ones. To start with, no two babies are exactly alike, even identical twins. Every baby is unique, both in look and mannerism. But there are some general aspects that are the same, or at least almost the same about them. Babies sleep for 16 hours or more in a day, so don't be alarmed about that. Of course, in between, there are periods of awakening, and they sleep so much in that even when you are giving them their bath, the baby is still sleeping. The baby is right there in the water in the bathtub and the eyes are not open. But it's nothing to be worried about. It's normal in them. However, during those periods when they are awake, they cry a lot. They cry a lot. And it's a way of communicating. They are trying to communicate to the mom and other caregivers that they are hungry or that their diapers are wet or that they just want the comfort of the human skin against theirs. So when they start crying persistently, please check these areas that I've highlighted. Then another thing about babies is that they also stool frequently. They stool up to 3, 4 times. So there is need to change their diapers. The same thing, they wet their diapers even more than the 4 times. You can see yourself changing the diapers up to 7, 8 times in a day. All these are normal. Then in terms of feeding as well, the baby is always feeding. Babies, it's like every 2 to 3 hours. And then for the formula fed babies, they tend to feed for less frequencies, feed every 4 hours. But all that is well and good. It's the normal behavior of a newborn. So let's go back to the feeding habits of the baby. If you decide to breastfeed your baby, which is best for baby, it's important that you know how to position the baby, that the baby latches on properly onto the nipple so that the baby sucks and you, the mom, you can actually hear sounds of swallowing in the baby. If the baby is not well positioned, this might cause sore nipples for the mom. And at this point, she may have to seek the help of a healthcare giver. If you decide to formula feed your baby, all well and good. Formula fed babies eat less frequently than breastfed babies, but all in all, breast milk, which is natural, is more advisable. But the choice is yours. And the more often you feed these babies, the more you expect that they will either wet their diapers or soil their diapers with poop. So it's important that you also keep checking. Keep checking to see if the baby has soiled or wet his diapers, and therefore change it so that baby will be comfortable and you will not have a baby that is irritable and crying all the time. Another thing we should note about these newborns, they have some reflexes which are natural. We call them primitive reflexes. When you notice this about babies, don't get alarmed. Sometimes you see them jerking. They have this jerking movement. But when you hold that limb, that jerking stops. It's normal. They do this, but it's normal. So don't get alarmed and think that the baby is having a seizure. If it's a seizure, even when you hold the limb, it will continue. Also, these jerks are not for a prolonged period, probably just 3, 5 seconds, and that is it. Also, you notice that your newborn baby may be cross-eyed. You don't get alarmed. It doesn't mean that the baby will grow up and have cross eyes. No, it's just that the muscles of the eyes are not yet well developed. Eventually, the baby will see straight and properly. Then another thing that one may notice on these babies, especially in the first week of life, is that there are rashes. We call them milia spots on the forehead of the baby around the face. These rashes will disappear within the first or second week, even without rubbing any cream on it. These are rashes that are due to accumulation of some dead cells right from the womb. Then we go to the baby's stooling. The stooling, like I've said, in a day, maybe about 3 to 4 times, and in the first few days of life, first 3 days of life or so, the stool that the baby first passes out is called meconium. It's darkish. It could be dark green. In some babies, you may even see it as black. Don't get alarmed. It's the normal stool that they pass in the first week of life, which the constituents are mainly debris from the gastrointestinal tract when the baby was in the womb. But as baby now gets older, by the end of the first week, the baby is now passing yellowish stool, soft yellowish stool, so that by day 5, 6, 7, what you'll see on the diapers are yellowish stools. However, and then these stools are devoid of blood or mucus. If they are blood stained or mucoid, please see your doctor. Then we talk about birthing the baby. Before we birth the baby, let's talk about the sleep pattern in these babies. Like I've told you, they sleep for about 16 hours or more, but not straight with periods of awakening. So the best way, there is a lot of controversy about the best way to put baby to sleep. But the most important thing, everybody agrees that baby should be put in a cot, most preferably on his own. You can share a room with baby, but try not to share the same cot with the baby because of we don't want any accident of the mom rolling over. So the baby's mattress should be firm. Then leave out the pillows or any stuffed up toys. And it's advisable that baby sleeps flat on the tummy with the face to the side so that the nostrils are free and baby is able to breathe freely. In the first month of life, babies hardly turn. They usually stay in that position that you've put them. So there's no risk of saying that the baby will suffocate by putting the face down on the mattress and suffocating. I prefer that babies are put flat on their tummy because of the frequency of abdominal colics. They feel more relief when they are put on their tummies than when they face up. There are different schools of thought about that, but that is my preference. And the mother herself, as time goes on, will note the position in which her baby sleeps longer. And after talking about the sleep, it's important to tell you young moms that usually in the first few weeks of life, baby does most of their sleeping in the daytime, and at night baby is awake. And when baby is awake at night, the mother too has no choice but to keep awake with the baby. But I can assure it's just for a few weeks, 1, 2 weeks, and after that, baby's sleep pattern would readjust, and both the baby and mother will have a better sleep pattern, with baby being awake mostly in the daytime and sleeping at night, so that that too is convenient for the mom. However, in those few weeks of life, when the baby sleeps mostly in the daytime and is awake at night, it's better for the mom to conform to that pattern as well. Let her have her rest in the daytime so that she'll be ready for baby at night. And then, yes, it's time for baby to have his bath. Of course, you would have checked out the water to see that it is lukewarm, not too warm. And in this part of the world, it's advised, that is in the tropics, it's advisable to give baby their bath in the morning and in the evenings using lukewarm water. And we, in this part of the world, we usually use soft sponge with soap and give the baby a proper bath, taking care of the crevices like under the arms, behind the ears, behind the neck, around the neck, and the groin. However, after putting all this soap, make sure you also rinse out properly with water. The umbilical cord care is very important. Yes, while giving baby his birth, make sure that around that area, some water may touch it, it's unavoidable. However, when you are drying up baby, see that you dry that area with a soft flannel properly. Dry off all the water on baby's body, including that on the umbilical cord. Then when you want to put on the diaper for baby, see that you leave the umbilical stump outside the diaper so that it can air dry. I also recommend as a pediatrician that you use chlorhexidine gel once a day on that umbilical cord. This is to avoid sepsis, and eventually the umbilical cord will fall off before the 10th day of life. And then after saying all this, generally, it's also good to note that baby should have his immunization when due. At birth, there is a series of immunizations that are given. I'll take the next video on that. And at 6 weeks, there are also some immunizations that are given. So it will be good for mom to always update her immunization schedule. She should have a card which should have been given at the hospital. She should keep to the immunization schedule of the baby because it is very important. And at the 6th week, when mother goes for her 6 week postnatal care, she should also see that the baby is seen by her pediatrician, who will also take a look at baby and examine and see that all is fine with the baby. Baby also uses that opportunity to take his immunization at 6 weeks. Having said all this, you as the mom, you also need a lot of rest. It will be good if you have a helper. Unfortunately, in this part of the world, here in Nigeria, it's a usual thing that the mom to the baby's mom is usually around, or at least another relation is around to assist the new mom in taking care of baby so that she doesn't break down, because it's a very trying period. It's overwhelming, especially for a first timer. So make sure you try to get help so that you can find time to sleep and also rest, because a stressed out mom is not going to do a very good job in taking care of the baby. And you also need your mental health to be intact to take care of this bundle of joy that has come into the family. So if at any time as a mom you are bothered about anything about the baby, do not hesitate to reach out to your pediatrician. If the baby's eyes are yellow, that is jaundiced. If the baby has blood-stained stools, if the baby is vomiting, if the baby has a fever, you feel the temperature is high, baby is not sleeping well, just anything you notice is out of place, please do not hesitate to go and see your pediatrician. I've tried to cover as many areas as possible. If there are any areas that I have not delved into, please put it in the comments section. I'll be sure to answer your questions. If you have enjoyed this video, please like, share, and subscribe so that together we'll grow a community of well-informed moms that will bring up healthy and bright children. Thank you. Bye. See you in my next video.